I'm doing research on older adults and women for so many reasons. There are so many questions out there. There's such a great need. You start down a path and it just opens a whole lot of other questions that still need to be answered. So there's so much to do is one of the reasons. It's also a time period where the population is really aging. This is different. You know, what it means to be old is way different than what we thought of as being old just a number of years ago. They're living lives that are way different than we ever imagined, and they want to stay well and they want to stay healthy, and it's our job to find ways to make sure that that's going to happen. Data are so important, and speaking as a researcher, you know, numbers are important. When you measure something, you see it, you learn from it. So there are a number of gaps in the healthcare system that I think are really important for women as they age. One of it relates to the fact that there's relatively few geriatricians who are there to help older women and older men in particular. So there's a big mismatch there that creates quite a challenge and means that we have to think differently about how we're going to provide care to this growing older population to make sure that they are able to stay healthy and well as they age. One of the challenges going forward, especially in geriatric medicine, is how do you find ways of helping other people, other specialists, incorporate the principles and the thinking of geriatric medicine into everything that they do. And this is something that's really being embraced at Women's College, where everyone in the primary care team is thinking about their older patients and how do they build health and wellness, not just when a person's older, but throughout their lifespan. One of the big data gaps, and I think one of the biggest challenges facing older adults and particularly women, is the data gap that exists around information about older people from research and in particularly about women. Even though now we're much better in terms of including older people and in particularly women in research studies, we're still not good at reporting the information. And as a result, data is wasted, data is lost. And that's one that we take very personally here at Women's College, and one that we're leading through our Women's Exchange initiative to help every researcher who's conducting research think about how are they going to incorporate sex and gender into their research proposals, and how are they going to make sure that that information is reported in their final studies.
Donors have a critical role to play in advancing healthcare. The area that we don't get funding for really has been in terms of research. It's important that we raise oodles of money through the foundation for this work. When we are able to come up with innovative solutions, we actually have a space where we can practice those innovative solutions. And so it's important that the donors know that they play a key role in terms of how we're able to advance health for women.
The research that we do is able to be taken up directly into clinical practice here at Women's College and goes out beyond to improve the lives of women here and across the country and across the world. So it's a wonderful opportunity to be part of this organization.
Women's College Hospital, it's more than a hospital, it's a bit of a calling. It's a hospital where the founding mothers were really clear about the need for health care for women. It's important that we be a voice for women's healthcare, that we advocate for women's healthcare, that we're at critical tables where decisions are being made about spending on women's healthcare. That's why Women's College Hospital is important. That's why the work we're doing is important. And not only are we doing that work, we are forwarding that work.